How do screens affect child development? That's the topic that we're going to address today on Flourish-Meant. I'm your host, Tina Yeager, and today's expert guest is Ginny Cruz. She is a pediatric physical therapist and award-winning author, and her latest book is The New Mom's Guide. Welcome, Ginny. I'm so excited to have you on the show today.
Thank you, Tina. I'm happy to be here.
Ginny, let's talk about children's brain development. Why is that a topic that's dear to your heart? You're a physical therapist, so that seems like it's a little bit different than what you might ordinarily want to focus on with kids. Why is that something that came to your attention and that drew your heart to add into your repertoire of topics that you like to address?
Well, Tina, you're right. Normally, a physical therapist would be working on motor skills, and that is what I did for over 30 years. But in the latter part of my career, I'm recently retired, but I was working in early intervention. I was an evaluator for those services. Early intervention is a program that's in all 50 states where children who are either already delayed with their developmental skills in those first 3 years, or they are at risk for delay, such as they have Down syndrome or they were born very prematurely. Those programs aim to evaluate those children as early as possible, determine if they have delays, and if they do, try to put in place with the family services that will remediate those as much as possible. So by the time the child goes to, 4-year-old pre-K or definitely by kindergarten, that some of those skills have remediated and they've caught up. Since 2020, when we were all in the lockdowns and we were doing evaluations for early intervention remotely over computer screens. And since that time and still to today, we're continuing to see a significant increase in the number of children who are delayed with their social skills, their emotional skills in those areas of development, their cognitive skills, which are for those children, for babies and toddlers and up to 3 years old, is basically how they play with toys. What can they do with toys? Or what are they not doing? And then their speech and language. And the studies continue. I kind of follow it. It's kind of like a hobby of mine to kind of follow the screen research, and it just keeps adding up of how damaging they're actually causing the brain to form differently than it should. It's not good. They're finding it on MRIs. And so the brain is setting up circuitry, how the brain communicates, is setting up circuitry that is lending itself to having problems later on. And that became something I wanted to try to remediate that's one reason I wrote the book, is to try to educate moms that maybe you could even prevent some of these delays.
So when you look at the research about the correlation between certain symptoms and the screen time that kids are exposed to in early childhood, what are some of the outcomes? Is it facial recognition, which lends itself to attachment and social interaction, social development skills? Is it executive functioning? Can you talk about what some of those parts of the brain that are being affected by too much screen time?
There's quite a few studies, but there was a recent study that came out earlier this year that really caught my attention. It was a longitudinal study. And for people who are listening who don't know what that is, that's where the scientists basically studied children from birth or infancy all the way up to over a decade. They followed the same children. They did 138 children. And then they did assessments on them at 4.5, 5.5, and 7, I believe. And they did an MRI on them. And they were also measuring, how much screen time. And that was self-reported by the family. So they were able to measure what they considered excessive screen time, which is over 2 hours a day. Then what they did is they followed these same children up to teenage years. And they found that they were having self-reporting increased anxiety by the age of 8. This is the children reporting anxiety. And then they were also reporting a lot of trouble making decisions, overthinking, struggling to maybe, I'm putting my own words in this, taking like real life situations where it's not predictable. It's not predictable. Like a computer is kind of becomes predictable, or, a game on a tablet becomes predictable. But life dealing with people is not predictable at all. And so they had trouble making a decision, like taking all that information in. And that continued even up past like 13. They were still having anxiety. And so that really alarmed me. And because we know anybody who keeps up with the news knows that we have a lot of anxiety and mental health issues with children in the schools. The teachers report they can't focus, they can't concentrate, they have impulse control issues, anger issues. And it made me wonder if some of the early screen time that they're getting is causing that. My goal is to try to help people understand you could remediate a lot of this if you just didn't do certain things. And that's what I'm trying to help people realize, that may be what you have to do.
I have seen some correlative evidence that it can lend to higher rates of depression. Did you find that to be true as well?
I have read that. It wasn't reported in this particular study. I have seen it in other studies. And, we just hear people reporting it, that they're experiencing it themselves, or I talk to mothers and their children are dealing with it. They can't seem to get off the devices and form real connections. We think of it causing things that, well, they're just getting anxious or they're having these problems. But when you think about, if you saw a picture of their brain and you realize their brain is not formed the way it should be, that's kind of startling, because we don't know if those things can be undone.
And there's a lot of aggressive behavior that's coming out now in younger and younger ages as well. This is how some kids act out when they're feeling insecure or anxious or depressed. And it can also be due to brain damage as well. So this aggressive behavior, whether it's verbal or physical, could that be related to the increase in screen time that kids are getting exposed to?
I personally think it probably is. The studies, I can't cite one exactly right now off the top of my head, but there's more than one study that has shown, that what we're watching on screens, especially handheld screens, tablets and phones, where the child is actually can control what's happening on the screen, those are more damaging than TV, because they can't necessarily interact or swipe it or do anything to it manually, physically through touch to change anything. They become addictive to us because it's creating a dopamine hit in our brains, a feel good, chemical. And it's very similar to the same dopamine hit you get if you're addicted to drugs. A lot of times when parents report, well, I can't take things away from these tablets or whatever away from my child because they act out. Well, it's like you've just taken away their feel good. It's like somebody coming down off of dope. It can be that severe. And so you see children who you try to take things away and they don't even have the verbal words to tell you why they're upset. Again, that's a communication problem. They don't have the words or the impulse control to slow themselves down and tell you why they want it. They just communicate physically by hitting you. They don't even have the impulse control. Again, that's another cognitive thing. They don't have the impulse control to stop that hit before they do it. And that's related to, basically, they're kind of addicted to these devices.
I'm noticing that the social skills have just gone downhill. The less that kids are able to connect in person with other kids because they're staring at their screens. And this is all ages, not just early childhood, but particularly damaging during those attachment stage connections that they need to be making, because that affects all their relationships they're on. Does that lend itself to things like cyberbullying?
Well, I think so. Working with babies and toddlers, which is really kind of my specialty, I have spent a lot of time learning how to read nonverbal communication, reading how babies are communicating because they're not using words. And I've worked alongside speech therapists my whole career, and so I've learned a lot from them, and learned that a lot of communication is nonverbal, and that's where the breakdown comes. If you're not dealing with people and reading their face or how they said something, not what they said, we try to communicate like texting. You can text something. If you don't put a little emoji there, it could come across like you're being angry, but if you put a little smile, and that's kind of replacing that nonverbal communication, but they're not learning how to read somebody's, how are they taking this information? Or They don't know how to deal with a conflict. They get very anxious and very nervous. They don't know how to stay in that conversation and control their own emotions enough to work through something. And again, that's where they're having these communication, I'll just call it a delay, and a social emotional gap there. They haven't practiced it enough.
Jenny, how can people stay connected with you and get a copy of your book so they can learn more insights, not just about screens, but about how to be the best mom that they can be when they're first starting out and they don't have any other guidelines?
Well, the fastest way to check that out is to go to my website, which is ginnycruz.com, and that's GINNYCRUZ.com. And you can find my book there, and it's available on Amazon. And that's the fastest way to find all of my connections there on the website.
I hope that all of you listening were inspired and equipped to be able to shift the types of input that your young children in your life are exposed to. And of course, I also hope that you will come back for the next episode of Flourish-Meant.